Morning. Today I wanted to talk a little bit about what we're seeing here in the practice, but also what other doctors and practitioners are seeing all over the country, is that there are more women that seem to be suffering from alcohol use disorder and from the consequences of that. You know, we're hearing about cases of women who are going into liver failure in their 30s and even having to get on transplant lists. We're hearing of more seizures. We're just hearing of more alcohol use disorders, alcoholism in women. And we've been seeing that in our office. I was thinking about this because just recently we had a patient who came in the early 30s and had already had 2 seizures last weekend when she tried to cut back. We were able to get her in for a detox and safely detox her using our protocol with phenobarbital, and she did fine. And she's now signed up for intensive treatment and her family's on board, and I think she's going to do really well. You know, we're using antabuse as one of the drugs that we use, but also long-acting naltrexone like implants and Vivitrol, and it seems to be very successful, especially when combined with intensive therapy. So I think for her it's going to be a good outcome, but I just wanted to get the word out that, you know, alcohol is deadly and tragic for so many people, and I'm not really sure why we're hearing more about women having more problems now than they did in the past. I don't think it's just a pandemic thing, although that's made it worse. I think it's become more acceptable, especially over 50 or 60 years, for women to drink and drink quite heavily. Maybe part of the women's lib movement, who knows. But it can be devastating for people who have that genetic vulnerability, you know, where they're genetically vulnerable to have an alcohol problem if they drink to a certain level. So we're seeing a lot of it. I think we need to all pay attention and really make sure that treatment's available when people need it. If there is any signs of a problem, if there's even some warning signs, you know, you can easily get a consultation with a substance abuse specialist like ourselves or with other therapists to try to nip things in the bud and prevent problems from getting worse. It's tragic to see so many people have the most serious problems, you know, with liver failure and things like that. So let's all pay attention and do what we can.